This is the world according to Mom and Luigi Carolyn.
Hey, girl.
How you doing? Happy New Year. Are we still saying that?
Oh, yes, we are. It's a week into the new year, and I feel like we're like a month in.
It's like dog years. Everything's going incredibly fast and coming at us incredibly hard, especially with the foreboding or the sense of foreboding, I think, at least us Democrats and progressives are feeling around the upcoming inauguration.
Yeah, yeah.
I know there's not, I'm speechless today. Trump was sentenced. It wasn't an actual sentence per se, but there's reason to feel hopeful. And I was actually engaging with some fellow Democrats on TikTok today who don't see what happened yesterday at the Supreme Court and today as a victory. I do see it as a victory in a sense. Mm-hmm. I think, going back to our Project 2025 episode in terms of what the plan is with the courts and stacking the courts with a bunch of Republicans, it was hopeful to see that the Supreme Court said, absolutely not. You're going to face your sentencing. We don't care if you're going to be president. And even one of Trump's appointments, Amy Coney Barrett, agreed. And it's nice to see that.
Now, do you think now he goes and fires them?
I don't think
what
he can.
happens?
I'm sure there will be some sort of retribution attempt. He is a petty narcissist, which is another win because you and I, as students of psychology, when a narcissist who is so desperate to not have to face sentencing goes to the highest court in the land and is told, nope. That is a huge blow to that massive ego.
Yes. Even just the little, like you kind of mentioned, it's a slap on the wrist.
Right. But, in the long run, is there hope that the courts, both at the federal level and at, Supreme Court level, that they will not simply just bow to the will of Trump and like associated litigants?
Yeah.
I'm hoping, right? That's one of the guardrails we talked about in Project 2025 that protects our Constitution and our democracy.
Right.
And what happened gives me at least an inkling of hope. Mm-hmm. So I do see it as a victory in that sense.
Sorry, I'm totally distracted. I love your earrings.
Oh, thank you.
No, these.
Oh, these. Yeah, these. Sorry. I think I got them. Well, I'm not shopping on Amazon anymore. At least I'm trying until they're permitted to unionize.
Those are really pretty.
Thank you.
Sorry.
That's okay. Girl distractions. Okay, we should talk about why we're actually here today, which is to discuss the history of the insurance industry. Now, look, we know we're not going to cover every aspect of every type of insurance. That is not why we're here. We're here to complain about health insurance specifically. Yes. But also, I think it's important to know how the insurance industry in the U.S. started. So most of you know, on December 4th, I think it was, of last year, a young man named Luigi Mangione gunned down United Healthcare Insurance CEO Brian Thompson. And instead of reacting with shock and disgust, people actually took to the internet to defend Luigi, offering fake alibis and posting health insurance horror stories. And, there's this resounding sense of shared disdain for the health insurance industry that was palpable. And I think as far as you and I are concerned, completely and totally understandable and justified.
Yes.
Is it right that, a man, a father, a husband was gunned down in the street?
I never think that's okay.
No, I don't either.
Violence is never okay.
It's not. But and at the same time, right. You can not excuse the violent act and still understand if in fact that's why he did it, right? We still don't. Yes.
Alleged.
Right. That's right. He's claiming innocence and we still don't necessarily know why, if he did do it, why he did it. Yeah. But people are grasping onto this as a way to air their discontent at the health insurance industry, which we know is diabolical and greedy and awful.
Yeah.
Carolyn, do you have any insurance horror stories?
Well, my question to you, does my uterus story count?
It absolutely does.
Yeah, I do. I mean, again, I have had two aging parents, one of them who has passed away.
Yeah.
But both my parents worked and saved and always were very well taken care of in that sense. But my dad went through a really tough time with hospice. My mom went through cancer and chemo. And so, just in that sense, and both my parents, father's a physician, my mom's a nurse. So these are people who work in healthcare. My sister's an attorney. I actually have a master's degree in public administration for healthcare.
Yeah.
All four of us were, hitting our heads trying to deal with all this stuff.
Yeah.
So, I can't imagine what it's like for the average American going through this, but I'll talk about my uterus story. So basically, long story long, I have had polyps in my uterus, which make you bleed profusely.
Right.
I missed your baby shower because I was basically bleeding out in the ER because I was sorry guys. I was having massive amounts of menstruation coming out of me.
Listeners we have. We're pretty vag positive. Right. We got some allies listening, I'm sure.
And Kaiser, bless their hearts, solution was, well, would you consider a hysterectomy as your first go-to?
What the fuck?
They're like, well, do you want to have children at some point? I was probably 35, maybe. Yeah. I was pretty, younger than that. Or however old Liam is. What was that? It was 7. Yeah.
Yeah. So this was 8 years ago.
Yeah. And so I was like, well, that seems a little aggressive, but they, and then it went a very managed care way where they really wanted to try every single option.
Yeah.
And it took finding, what was her name? Dr.
Oh, it's my OB. Yes. It's my obstetrician.
Yes.
Dr. Norell.
Dr. Norell. She fucking amazing. Was like, this is bullshit. You've been bleeding for a year. This is unacceptable. We're getting you in. Here we go. But again, and I've actually had pretty good experiences with Kaiser, but I advocate the shit out of myself.
You have to with Kaiser. Absolutely. I agree 100%.
I have my doctor understands me. If I ask her for something, she doesn't argue with me. Same relationship with her for many years. But I don't think that quite was I was able to get what I needed, but you have to fight.
And that was more, I think, an argument with physicians who were doing the bare minimum. And I think, unfortunately, that happens far too often when it comes to women's healthcare.
And these were women physicians
stuff. That's
too.
Fucked up.
Women obese.
Yeah, that's awful.
Yeah.
That's awful. And sometimes Kaiser will do that exploratory shit where you're like, no, I know there's a solution.
Well, let's try this first, and then let's try this, and then we'll try this, and then we'll try this. And it was like a year later where it was just like, this is nuts.
Nothing's working.
So I don't think that really was as horrible as I think what most people go through.
It's still shitty.
But it was just annoying.
It's still shitty. So I'll be brief about this, and I can talk about this without getting misty because my child is no longer epileptic. But when you have a 6-month-old baby who's had 4 seizures in a day, like I was home by myself, called 911. The EMT was super cool. Another city person was convinced it was associated with a fever. I'm like, he doesn't actually have a fever. Anyway, the minute we got to the hospital, he had another seizure and then subsequently 2 more. Anyway. You are parents of a 6-month-old baby that you were literally watching have grand mal seizures. And so when the doctors who are present tell you, we're going to go ahead and send off his brain scans to Stanford for a second opinion. You're like, absolutely, send them off. Yeah. Well, little did I know that was going to cost us money. And that when you go in and you admit your child or whomever yourself to the ER, you are essentially signing documents that say you might be treated or you might receive care that is outside of your network and you agree to pay.
Yep.
Fortunately, I fought and I fought and I fought. It took probably 2 years and they acquiesced. But can you imagine?
No.
I went to an in-network hospital. I was dealing with whom I thought were all in-network doctors.
Yeah.
I'm worried my child is going to fucking die.
Yeah.
And then I get hit with a $3,000 bill. Are you fucking kidding me?
Yeah. And that's the main point, I think, of where we're at in this country is that people have insurance.
Yes.
And aren't able to use it.
Well, we're going to talk about that later. How many people actually go into debt and go bankrupt over healthcare costs, even when they have insurance.
Yep.
That is despicable. So let's start from the beginning where we always like to start. And we're going to start with the history of insurance. So the concept of insurance dates back to around 1750 BC with the Code of Hammurabi, which Babylonians carved into a stone monument and several clay tablets. The code describes a form of bottomry. Sounds a lot sexier than it is, whereby a ship's cargo could be pledged in exchange for a loan. Repayment of the loan was contingent on a successful voyage, and the debtor did not have to repay the loan if the ship was lost at sea. Cool. Then the 1600s, this is all around shipping, right? So shipping was just beginning between the New World and the Old as colonies were beginning to be established and exotic goods were ferried back. The practice of underwriting emerged in the same London coffee houses that operated as the unofficial stock exchange for the British Empire. A coffee house owned by Edward Lloyd or Lloyd's of London was the primary meeting place for merchants, ship owners, and others seeking insurance. I think Lloyd's of London is still around.
Yes.
Yeah.
Isn't it it's a clothing company, right?
No, I think it's still an insurance.
Oh,
I'm pretty sure it's an insurance broker. I could be wrong.
Harrods.
Something to do with money. Yes. So venture capitalists of the day would fund voyages with the requirement that those doing the voyaging would share dope shit with them if they found it. It was widely believed. Yeah. Spices. Oh, I got some noodles. It was widely believed you couldn't take 2 left turns in America without finding a deposit of gold or precious metals. No, it's a shithole country.
Yeah.
Trump. Those who were interested in taking on the risk signed at the bottom of the manifest beneath the figure indicating the share of the cargo for which they were taking responsibility. Hence, literally underwriting. In a way, a single voyage would have multiple underwriters who tried to spread their own risk by taking shares in several different voyages. Then in 1654, we had some dude named Blaise or Blase Pascal. Blase, bitch! The Frenchman who gave us the first calculator, and his countryman, Pierre de Fermat.
Good job.
Did I do it right?
Yeah.
Yes. Discovered a way. I dropped out of French class in freshman year of high school. Discovered a way to express probabilities and better understand levels of risk. That breakthrough began to formalize the practice of underwriting and made insurance more affordable. So in 1666, the Great Fire of London destroyed around 13,200 homes. Unfortunately, California right now, in Southern California, we are experiencing our own terrible fire, and many, many homes have been lost. So this sounds very relatable. London was still recovering from the plague and had begun to ravage it a year earlier, and an estimated 100,000 survivors were left homeless. So property developer Nicholas Barbon began selling fire insurance as a personal business. So that's how fire insurance started. Now in California, most people aren't going
to be able to get it.
No, you're not.
Flood insurance or fire insurance, which is hella fucked up.
I know. We have a family home up in Lake County, and we are so diligent about making sure that insurance doesn't lapse because we're worried if it does, we won't be able to get insurance again. So
you're on top of that bill then, aren't you?
Oh yeah, we absolutely are. Well, Bill is incredible.
Really?
My husband is really good at paying the bills.
I would have thought you would have been the bill keeper.
He handles all the finances. I handle everything else.
Okay.
Except for picking up dog shit in the yard. That is also his job. Everything else falls under mom.
Cool.
So life insurance, 1693, an astronomer and mathematician named Edmund Halley. I'm sure you've heard of this guy. Halley's Comet. Yeah. Studied birth and death records in the city of Breslau for the purposes of calculating the price of life annuities.
Sorry, those in Breslau.
Breslau, yeah. We're sorry if we offended you. This gave rise to the use of these mortality tables that are actually still used in the insurance industry. Then the U.S. colonists' lives were fraught with dangers that no insurance company would touch. For example, starvation and related diseases killed almost 3 out of every 4 colonists in the Jamestown settlement between 1609 and 1610.
Where's the gold in California?
Dude, I know. We gotta skip ahead to, 1849 to get to that gold real fast. Because this is dark. This period was known as the starving time.
Yikes. Worst time ever. Sorry, I shouldn't laugh at that.
It's so awful. I mean, we think shit's bad right now, and it is.
I know.
But we're not hit with like
the starving time.
I mean, okay.
Well,
we were hit with kind of a plague. Yeah. And then we were hit with a bunch of like fires and terrible things. This was 2020. And now this year started with a terrorist attack in my favorite city in the goddamn world. And now we're experiencing crazy wildfires. So I kind of feel like the starving times are coming. Oh, eggs are $8.99. So
we paid $12.
Oh fuck, dude! Where did I? Safeway. Safeway was $8. Yeah, you're all white fancy, dude.
I know.
Go to Safeway. They're a union. Anyway, so then 1750s brought the maturity in both practices and policies that developed during the same period as in Europe. Then this is from Zebra. I don't know what the hell this is,
dude. Zebra's big in the Like I found 3 other articles from them. Yeah, we have a couple things from them.
Well, probably because we use ChatGPT to help us write this.
No, we don't.
They must love zebra. Guys, ChatGPT makes your lives easier.
The same girls who liked Cliff's Notes are also cheating on their podcast.
They're modern day Cliff's Notes. Yeah. They just assemble the information in a way where everything is consolidated. We're not using them to write our scripts. We're using them for research.
Conciseness.
Yes, me too. I'm not about brevity. So, the 18th century saw the establishment of the first insurance companies in America, the Friendly Society, which was founded in 1735 in Charleston, South Carolina. Then you had Mutual Insurance, which went out of business. Then you had the Philadelphia Contribution Ship. The Ben Franklin helped start this one. Life insurance, or insurance for housing, fires, etc. So you saw all that shit happening. But let's talk about slavery, because that was a component too, because unfortunately people were property, certain people, Black people. Slave insurance in the United States became an increasingly significant industry after the act prohibiting importation of slaves. A federal law, which took effect in 1808, prevented any new slaves from being imported to the U.S. So these slave owners were like, well, we better take care of our investment and make sure we insure these slaves. Awful.
By treating them like shit, too, by the way.
And then Chinese slaves, who were called coolies, were also insured.
It's a really weird slur.
I have no idea. I don't know how that works.
I don't know. Yeah, I know.
Anyway,
right?
It's fucked up. So from the BBC, some of the largest insurance firms in the U.S., New York Life, AIG, and Aetna, sold policies that insured slave owners and ensure they would be compensated if their slaves they owned were injured or killed. So let's skip ahead to our favorite topic, health insurance, because this is really, as far as we're concerned, the most egregious insurance industry. So the bulk of our episode, as we said, is going to focus on this. So there was a really good, interesting article in Stanford called "How an Industry Shifted from Protecting Patients to Seeking Profit." 100 years ago, medical treatments were basic and cheap and not terribly effective. They were often run by religious charities. Hospitals were places where people mostly went to die. Care was administered at home and by doctors who made house calls for really minimal fees, or quacks sometimes. Sometimes you got some people that didn't know what the fuck they were doing. They're like, let's put some leeches on it. So the earliest
work.
Kinda. Suck out all the bad
old-timey concoctions.
Let's bring them back. So the earliest health insurance policies were designed primarily to compensate for income lost while workers were ill. And long absences were a big problem for companies that depended on manual labor. So they often hired doctors to tend to workers. So in the 1890s, lumber companies in Tacoma, Washington, paid 2 enterprising doctors 50 cents a month to care for employees. That was big time back then. It was perhaps one of the earliest predecessors to the type of employer-based insurance that we have today in the U.S. So the archetype for today's insurance plans, they were developed at Baylor University Medical Center in Dallas, Texas, now part of Baylor Scott and White Health, since it merged with another health system in 2013. Now it's a giant fucking conglomerate. So it was founded originally in 1903. It was a 14-room mansion run by the Baptist Church. A devout cattleman provided the initial $50,000 in funding to open what was then called the Texas Baptist Memorial Sanatorium, a great humanitarian hospital. And by the 1920s, more and more Texans were coming for treatment. And when Justin Ford Kimball, a lawyer who was Baylor's vice president, found out that the hospital was caring for a huge number of unpaid bills, he offered the local teachers union a deal. For $6 a year or 50 cents a month, teachers who subscribed were entitled to 21-day stay in the hospital, all costs included. But there was a deductible. Aha! Remember that from Coming to America? No, you've never seen Coming to America.
I fall asleep every time. It's so sad.
Okay, there was a deductible. The insurance took effect after a week and covered the full cost of hospitalization. $5 a day, which is about $105 in $2006. So within a decade, the model spread across the country. 3 million people had signed up by 1939, yada, yada, yada. So Blue Cross plans, right? So the goal of Blue Cross initially, which is obviously one of the huge health insurance companies, it wasn't to make money. They wanted to protect patient savings and keep hospitals and the charitable religious groups that funded them afloat. Blue Cross at that point was actually a nonprofit. And then technology started evolving really rapidly. And then the National War Labor Board froze salaries during World War II, and companies facing severe labor shortages discovered that they could attract workers by offering health insurance.
You still can.
Yeah, exactly. We need it, guys. So the original purpose of health insurance was to mitigate financial disasters brought about by a serious illness, such as losing your home, but it was never intended to make healthcare cheap or serve as a tool for cost control. So then we get to more modern era, right? 1940 and 1955, the number of Americans with health insurance skyrocketed from 10% to 60%. And this was before government programs like Medicare and Medicaid. Okay, then Blue Cross Blue Shield logo became ubiquitous as a force for good across America. According to their charter, they were a nonprofit. All members were charged the same rate, no matter how sick. All they cared about, at least initially, was making sure that people were cared for when they were sick.
Seems like a good goal.
And then for-profit insurance companies moved in. Unencumbered by the Blues' charitable mission, they accepted only younger, healthier patients on whom they could make a profit, and they charged different rates depending on factors like age, etc. So by the 1990s, the Blues, which offered insurance in all 50 states, they were hemorrhaging money. So they were trying to keep this going until the 90s, apparently, having been left to cover the sickest patients.
I was really surprised to read that.
I know. Me too.
It feels so recent.
And in 1994, after state directors rebelled, the Blues board relented and allowed members to become for-profit insurers. The rest is history. Where are we now? The American Health Insurance Company is worth $4.5 trillion, is the country's largest private employer, and makes up more than 17% of the economy.
Isn't
that staggering? It's fucking staggering.
17% doesn't sound like a lot.
Yeah, but it's huge.
But that's
ridiculous. It really is. The industry was estimated at approximately $1.5 trillion in 2024, with projections to reach $2.1 trillion by 2029. And then the total spending on healthcare across the U.S. equates to $13,493 per person. Remember that, guys. Double the amount most other wealthy countries spend, according to figures from the Organization for Economic Cooperation and Development. United Healthcare, that's where the CEO who was gunned down worked. The country's largest insurer, with 50 million customers in the U.S., is said to have turned down claims at roughly double the insurance average. All right. So basically you have doctors saying that patients need treatments, procedures, etc. And insurance companies are like, nah, not necessary, in spite of an actual fucking doctor saying that they are. So Carolyn, can you talk to us about why, in spite of having health insurance, these companies turn down claims at an alarming rate?
Absolutely. I want to say something too. If you want a really good book about the history, I went back and looked in grad school. We read Insuring America's Health by Christy Ford Chapin, and it explains why a lot about the U.S. healthcare system offers basically world-class medicine. Technology has enabled a lot of that to some patients. But, again, the fragmented care, the poor distribution, kind of everything we talked about really goes into kind of the World War II post and the VA health system, all these things. So anyway, yes, this is both absolutely frustrating, and it's a common issue. And the U.S. healthcare system, you can ask anyone and they'll have a fucked up story about themselves or someone that they know. Medicine, like I said, medicine and technology have change this landscape. I think I mentioned this in the last podcast. It is phenomenal what science has done for us, what we're able to do and what we're able to cure versus, 100 or even 50 years ago. But the root cause of this problem is a fundamental disconnect between, I think, the ethical priorities of the healthcare providers, doctors, nurses, people who really, I'm going to include myself, a mental health practitioner. You go into this because you want to help people or someone helped you.
Yes.
And, the providers are supposed to be there on behalf of their patients.
Yeah.
And insurance companies, it's a very unsafe relationship. It's a very violent relationship, I think, that we have with insurance companies. Do you know that there's actually a job title called a denial nurse?
Oh, God.
That's a job title.
It doesn't surprise me, but it just saddens me.
And I think when is it a Siegel quote? I should look this up, but it's, when you're getting paid to do something, I think you start to forget the ethics within it. I'll try and find where I read that quote. It's not mine, but companies like Cigna got caught using AI, and they're not the only one, to do automated reviews. 50 files in 10 seconds.
Oh my God.
And automated systems and algorithms are prevalent in insurance companies, and they're dealing with millions of claims. Now, because I come from a public health background, my question is not going to be, how can we fix these insurance agencies? How can we fix these costs? And I won't stay on the soapbox too long. Why are we all so sick? Why is the largest, preventable diseases happening? And I think it goes back to the pillars of wellness. We're not getting good sleep.
Right.
We're not eating good nutrition. We're not getting physical activity. Yeah. We're not socializing. Right. And there's a level of stress going on. These are endothelial diseases that you're seeing. And yes, we have medications, but Parsley Health is a group that I'm very fascinated by, because they're functional medicine, and it's never just one thing. And medicine is about systems. Yes. You cannot treat one thing without treating the other. And that's my big problem with health insurance and mental health, because you're treating brain health very differently than you would body health.
That was which my zipper,
makes
not my butt.
No sense.
Yeah, no, we've talked about this. Physicians will oftentimes act like your brain is not a part of your body when it comes to mental health.
It's all connected.
Yeah.
And you can't talk about any health if you're not asking clients about their sleep, their nutrition, their all these other things. Yeah. But you get, again, when you only get 5 minutes per patient, you're supposed to see 50 patients a day, and you have to do all these charts. So again, why is America so sick? I could do a whole episode on that. But anyway, so if you want to read a really great article, I'm looking at my phone here. ProPublica reporter Annie Waldman, did. This is from a PBS documentary, but they did a lot of this information is not public access. Insurance companies don't have to report certain things. So there's, again, you have just a lot of different parts, and it's all very fragmented. It's all very decentralized.
It's deliberately confusing.
Yes. Yeah. And even within the insurance company, there's parts not talking to each other. So again, that's a great article. You can, the links in the show notes. Robin Fields wrote the article in 2023, ProPublica, the lack of transparency, insurance denial rates, and critical measures of how reliably they pay for customers' care remain mostly secret to the public. Federal and state regulators have also done very little to change that. I love me some Bernie Sanders. Yeah. I feel like when Bernie was running in 2016, healthcare was on the mark. People were talking about it. I don't feel like it got the attention that it's 70% of our
No,
GDP.
You're absolutely right. And I think that I don't know if things would have gone differently, because you know how I feel about racism and sexism in this country. I can't speak tonight. But had Kamala talked about more populist shit like that, she might have had a better chance. And that's what Bernie does. He pushes
I love Bernie.
The envelope. The envelope, but
love him.
Pushes people to adopt more, not even more progressive policies, more practical policies as they relate to the majority of the population of this country.
Well, and how fucked up is it that it's considered progressive to be ill and want to not to die?
Right. Or go bankrupt.
Is that progressive?
I know.
God, if that's progressive, then what the fuck? And it's weird to me, too, that Republicans who are so fiscally responsible are okay. Well, that's why the whole bipartisanship of this.
Well, Republicans constantly say, sorry to interrupt you.
No, go ahead.
They constantly say, oh, we don't have the money to fund universal health care or Medicare for all like Canada does. We don't have the money. Yet the absolutely egregious tax cuts that corporations get could easily pay for this. And people act like we're not paying high taxes. Yeah, granted, we're not paying as high a taxes as people in like fucking Amsterdam.
Sure.
But we're not paying nothing. We're paying a lot of taxes.
Well,
we're not getting much for it.
And what's more, and I'll give the name of this one because I'm going to bring up Robin Breslin, Berzin, who's the owner and co-founder of Parsley Health, Rich Roll podcast. Great podcast about, she talks a lot about this, that we're spending a lot of money, but our outcomes are shit.
Right.
And she gave this statistic that in order for something to be considered, I'm going to use the wrong word, but for lack of a better word, helpful, there's has to show a 5% improvement.
Okay. Successful. Yeah.
Successful. She's able to do that same thing. It might take a little longer, but 20% improvement.
Wow.
Rather than just giving someone a drug that's going to stop something, but then it's going to progress, 20% is unheard of in the insurance industry.
Yeah.
And so, you're seeing lots of money. You're seeing lots of red tape, but you're seeing very little improved outcomes. In fact, you're seeing things get worse and worse and worse. Yeah. Why is that? Because it's heavily linked with the drug company. You cannot have a conversation about pharmaceuticals, about health insurance, if you're not going to talk about the pharmaceutical companies, which have zero oversight in the United States. We're one of the only countries that has zero oversight of pharmaceuticals.
That's unbelievable.
Which is fucked up.
That is fucked up.
I digressed a little bit. Sorry. Talking about, I told you it makes me sweaty.
It's all related.
So health insurance claim denials are significant issues in the United States healthcare system, with insurers denying between 10 and 20% of claims they receive. Here's the ProPublica information. In 2021, nearly 17% of in-network claims were denied by insurers in healthcare.gov, which denies rates widely from 2% to 49%. I keep calling this KFC. It's K.
That's how I saw it.
KFFC.
I always want chicken.
I know, right? Give me some Taco Bell. I'll go Taco Bell over KFC. But the KFF was reported a lot. It's a claims denial and appeals in ACA marketplace plans. They basically look healthcare.gov marketplace. They do all this data and statistics. It's more than you could want to know. But anyway, so here's some common reasons why claims get denied. Errors in claims. Services are not deemed medically necessary. Lack of prior authorization. Services not covered. And again, and my dad used to say this all the time, and I always was like, oh, he's just talking, but I get it now. I know. I wish he was still alive, because we probably would have had some really cool shit to talk about.
Yeah.
He would say, this is so frustrating. I'm the doctor.
Yes.
I went to school.
Yes.
I took my boards, and I'm having to be on the phone for an hour with someone to prove to them why my patient needs something.
Yeah.
What now? Again, I get that there's going to be people who take advantage of things, but we've gone over the line here.
Yeah.
So, okay, these denials can lead to delays in necessary treatments and financial burdens for patients. The appeals process for denied claims is cumbersome, as you talked about.
Yeah.
Many patients actually don't pursue it in leaving denials unchallenged. So here's another thing from the KFF.
The KFC. Bring on the KFC.
Recent murder. So we talked about healthcare, Brian Thompson from United Healthcare. We know there's intensified public scrutiny of insurance company practices and concerning claim and authorizations, but we're really still not seeing any changes. And this is, again, going back to my dad, follow the money train.
Yeah.
Right? Profit motives. Insurance companies operate as a business, and often profitability is prioritized.
Yeah.
Paying claims reduces their profit margins, so they have financial incentive to deny or limit coverage when possible. We could do a whole episode on this. I hate utilization review process.
Tell me more about what that is.
So we call them URs. So basically, when a doctor recommends a treatment, this is what my dad would have to do. And it was mental health. I have to do this all the time, which is why I hate working in this world. So an insurance company doesn't always take that recommendation at face value. So you have to do these URs, utilization reviews, to determine if the treatment is medically necessary by their standards. Now, here's what's irritating. Every company has different standards. So if I'm talking to you, and from a mental health perspective, if I'm talking to United Healthcare versus, and there were certain ones where we knew we'd be on the phone. Sometimes I'd be on the phone for 3 hours.
I know.
Dealing
I worked
with
briefly with an insurance agent.
Did you really?
And it was fucking awful.
Oh,
yeah.
And so each one has a different rubric on what authorization gets covered.
Which is stupid. And you're never talking to a therapist.
Nope.
Who has the same, licenses and experience and education as you. Nope. You're never talking to a doctor. These are just,
they want to know arbitrary things that from, again, in medicine, I think it's a little easier.
When was your last period? How is that relevant?
I don't know. What I ate for breakfast this morning, bitch. So again, you have to know the criteria. I mean, and sometimes we'd have to write papers.
Yeah.
Because at one of my jobs, we actually had a utilization review person.
Oh, wow.
Where that's all she did.
Holy shit.
And
well, I imagine it would take a ton of time.
I loved her. But we'd have to write reports for her. So part of my job was spending at least 2 or 3 hours writing a report why I thought this kid deserved to be get another 30 days covered when they had insurance.
It takes you away from doing the care. The
and
reason why you're there.
It makes us want to do. It makes me not want to work in companies where I have to do that. I just want to work for myself. And even though I do that, I still sometimes every once in a while have to do a utilization review. And I don't get paid for that. I do not charge my clients for that because that's fucked up.
That's really nice of you.
Well, I make enough. It's okay. Yeah. But, so again, denials, you would get, sometimes I'd be arguing for 3 days and then I'd have to call again to get another 3 days. This person's detoxing. They're not going to get better in 3 days, believe it or not. They're not going to get better in 90 days. No. Go fuck yourself. Anyway, red tape galore. So the administrative the administrative and bureaucratic hurdles insurance companies require documentation, pre-authorization, appeals, narrow coverage policies, cost shifting to patients. So by denying claims or denying approval, insurance companies push patients to pay out of pocket for urgent care or seek alternative treatment. And sometimes those are cheaper, sometimes, but usually they're not. No. And again, appeals and oversight. You talked about this with trying to advocate for your son. Yeah. Patients can appeal denial claims, but this process is extremely time consuming. It's extremely cumbersome. Like I said, I have a fucking degree in this. My sister's an attorney. Yeah. We were fighting to get hospice for my fucking father so he could die at home and get oxygen. Yeah. And this is someone who has coverage. That should not be. No, he doesn't need oxygen because he's about to die.
Oh my God.
Cool. Thanks.
Oh my God. Yeah. Let's prolong suffering. Yeah. Let's make this really fucking hard for your all dad of you. And your family. Yeah. Yeah. God damn, it's so heartless. Who does these jobs? I'm really sorry, but one time I had to yell at somebody because they were delaying authorizing my kid getting speech therapy. And one of the justifications for why our premiums are so high is because of the high administrative cost. And I'm like, what are y'all administrating? It's been over a month. And I literally was like, how can you do this fucking job? Yeah. How do you say no to people in need every day?
The denial nurse, I don't know.
Holy shit, I couldn't look in the mirror.
No, I couldn't either. I know.
Oh man, I'd want to kill myself.
Lack of transparency. Patients and providers don't have clear insight into the criteria. I talked about how different insurance companies have different measures of success and what constitute or what each thing does, what they will and won't cover. Yeah. So we know this has real world consequences. Totally. These are human beings. This is affecting the patient. This is and stress can't be good for your health.
No, can it? That's the reason why we're so sick. Yeah, one of the reasons.
Doctors I think it affects people who want to work in that industry.
Yes, totally.
And it also the health outcomes worsen. Yeah, and so yes, we need legislation. Yes, we need public awareness. Yes, we need advocacy. But the reason that bothers me is because you're putting the blame or you're putting the work on the public. Right. When in my mind, I don't know what. I don't have an answer. Well, my answer is universal healthcare. Right. But when an MRI costs 40% more in the United States than it does in Canada.
What's the justification for that?
I don't know.
Like when I look at the amount that these things cost that I'm not paying for because I happen to have very good health insurance, thank God. I'm like, what justifies this amount of cost? And I understand like these are very technologically advanced interventions a lot of times, but really, give me a fucking break. I don't know how they quantify some of these things. It's insane.
Apparently, if you want to have the best, go to Australia.
Oh, they're good?
Yeah. Our cost, it was something like the MRI thing specifically was like 420% higher in America compared to Australia. Oh my God. 42% higher in England.
They're using the same.
I'm sorry, 42% compared to England.
Oh my God. They're using the same machines. They're using trained physicians and technicians just like we do. Mm-hmm. It's fucking bullshit. Mm-hmm. So let's talk about, since we're on the topic of money, let's talk about medical debt. So this is an article from The Times. Despite 305 million Americans having some form of health insurance, medical debt remains a pernicious problem. Some 20 million people owe an estimated $220 billion, according to the 2023 census. About 14 million people owe more than $1,000, while 3 million people owe more than $10,000. An estimated 550,000 Americans who file for bankruptcy each year cite medical bills as the primary cause. An unpaid medical bill will affect a patient's credit score, making it more expensive to get a loan. People with disabilities or in worse health, lower income people, and uninsured people are more likely to be saddled with medical debt, according to the Peterson KFF, see there's KFF, health system tracker. Americans will often find their medical needs are not covered by their plans and can be hit with huge bills for unexpected illnesses and injuries. Nearly a quarter of working age adults in the U.S. were underinsured in 2024, according to a study conducted by the Commonwealth Fund.
Yeah.
So medical in other developed countries. Let's talk about medical care in other developed countries. Be prepared to feel even worse about this country that's about to be an authoritarian regime run by Donald Trump. Woo! Universal healthcare is a system where all residents of a country have access to essential healthcare services without financial hardship. It is a hallmark of developed countries and is achieved through various models. We're not going to bore you with all the models, but these are the most important takeaways. Equity and access. Universal healthcare ensures equal access to medical services regardless of income or social status. Comprehensive coverage. Services typically include primary care, specialist care, hospitalization, preventative services, and sometimes dental and vision. Lower out-of-pocket costs. Patients face minimal or no financial barriers to care due to subsidies or fully covered services. Focus on preventative care. Emphasis on prevention reduces long-term costs and improves public health outcomes. Countries with universal health care often rank higher in life expectancy, lower in infant mortality, and general health, and higher in general health metrics. So it reduces the financial burden on individuals and increases economic productivity by ensuring a healthier workforce and populace. What a fucking concept.
It seems so obvious.
I think there's more money to be made on people being sick than there is on people being healthy and productive.
How much money do we need?
That's the problem. You and me are normal people.
I'd be happy if I had
our
$20.
happiness. Right. Well, I mean, again, like, I don't want to speak ill of the dead, but how much was Brian Thompson making every year? And when you think about it, when you look at it from like a philosophical perspective, for lack of a better word, how many people died or went bankrupt because of the policies that he was responsible for enacting and implementing? Now, I'm not, again, we're not saying that he deserved what happened to him. And at the same time, I think it's important to reflect on what somebody in that position's job is.
Yeah.
You make money for yourself, for your company, and for your shareholders
at the top
by denying.
And then it goes all the way down.
Yes. The only way that you make money, or the primary way you make money, is by denying people access to something they fucking pay for.
You're betting on your life.
Right.
They're hoping you're hoping you live. They're hoping they'll make money and you die early.
Right.
The earlier you die, the better.
Right. Or the longer you live and the more money they can make off of you, if they intend to charge you out-of-pocket fees. I don't know. The whole thing just seems really sick to me. And I'm sure we're missing some of the nuances, but I don't think any of the nuances and technical aspects would change our fucking mind because it's wrong. It's morally wrong.
Reprehensible.
I had a great professor in my graduate program who was like, never discount what you know.
Yeah.
Like, don't be dissuaded or you know, that just stuck with me anyway. So let's look at the United Kingdom. They have a national health service, right? It's a fully tax funded and provides comprehensive services free at the point of use. Canada. Provinces administer healthcare with federal funding, covering most services through public insurance, Medicare for all. Germany, a mix of public and private insurance with mandatory coverage for all residents. Japan, a multi-payer system with universal coverage through employer and community-based plans. So those are just a few countries that offer universal healthcare, or Medicare for all, whatever you want to call it. Just know that the majority of developed countries prioritize free or low-cost healthcare for their citizens. The U.S., however, is far more concerned with profit. So you want to know which countries have the best quality of life according to U.S. News and World Report?
Canada.
They're on here. Yes. The top 5 are in this order: Denmark, Sweden, Switzerland, Norway, and Canada. All but Switzerland have tax funded or in the case of Canada, single payer, basically Medicare for all insurance. Switzerland, however, has a universal mandate for health insurance. It's not free. But in 2022, total private household contributions to healthcare, including premiums, deductibles, and out-of-pocket, averaged about $6,300 per person a year. That's their currency. It's about $7,000 US. So how the government, though, offers tons of subsidies to make insurance affordable. Ain't no one going broke in Switzerland for medical costs. I looked it up. Bankruptcies in Switzerland due to medical costs are extremely rare, especially compared with countries like the US.
And look at what their cars versus bikes.
Right.
Their work-life balance.
Yes.
Their food.
That's right.
Their physical fitness.
Yes. It all is significantly better than what we have here. Look, I was in Amsterdam a year and a half ago.
Ooh, you fancy.
I was fancy because Carolyn took care of my child. But we were on one of those canal tours.
Yeah.
And the tour guide was fucking awesome. And we saw these kids who were on like a school field trip. And they were fishing plastic out of the canals. And it's a program.
Even their field trips are cooler.
Dude, it's called like Plastic Whale or something.
We just go to the symphony.
I know. I didn't get that. I was in public school, baby.
You didn't get to go to Davies Symphony Hall?
Girl, we went to the Cal Academy. That was about it. So anyway, so he said, he looked at that and he goes, you know what? There are studies that have been conducted that show that children in Amsterdam are some of the happiest in the world. And he goes, I firmly believe it is because of our universal health care. Children are healthy. People are healthy. It makes a massive difference.
Life is hard enough.
I know.
Childhood is hard enough.
I know. Why should you have to worry? And why, as a parent, should I have to worry when my kid has multiple seizures in a day that I'm going to be hit with a $3,000 bill? It's insane. So this is from the center. So we don't, again, I don't think it's a coincidence that the countries that we named have happy citizens because their medical needs, like I said, in reference to Amsterdam, are fucking met.
You all matter.
Yeah, exactly. It's weird concept, right? So speaking of happiness, let's talk about something that Carolyn and I are all too familiar with, and that's the lack of free, of affordable mental health options in this country. I'm going to say a few things, and then I'm turning it over to you, Carolyn. This is your wheelhouse.
Yep.
So where was I? I lost my place. Okay, this is from the Center for American Progress. For far too long, people, especially people of color, people with low incomes, and people with disabilities have struggled to access behavioral health care in the U.S. Reports of individuals endlessly navigating inaccurate provider directories, insurance denials, and expensive treatments have proliferated in recent years. So, you know, prior to 1996, there were no national laws in the U.S. to govern behavioral health care coverage. So that changed in 96. Congress passed the Mental Health Parity Act, which prohibited large group employer-sponsored health plans that provided mental health benefits from imposing more restrictive annual or lifetime limits on mental health benefits than those imposed on medical or surgical benefits. So that's helpful. But, you know, the law's requirements are limited. It allowed treatment limits, insufficient numbers of covered facilities, differences in cost sharing, restrictive medical management techniques. You know, all of that stuff was still intact and making it difficult to access care. ACA tried to change this or tried to make, you know, a bit of a difference. It did. They extended parity regulations from group plans to the individual health insurance market, requiring parity for an additional 11 million individuals. That's huge. So parity doesn't go far enough. As you said, you know, given reimbursement rates that are lower than other specialties and have not increased in decades, as well as shortages in the mental health workforce, it's no surprise that network participation among behavioral health providers is super low. So talk to us about that. I know this is something that you've got quite a bit of experience with. Can you speak to your struggles with insurance companies and also how low income and people of color are the most adversely impacted by this?
Absolutely. So I went to a graduate school at USF, which was I chose that school because it was social justice oriented.
You and me both, girl.
You actually got a little bit more. I had a couple. I did. Tom Bequee, he did the best class on mental health, but there was this sentiment that if you were going to go into private practice, you kind of were not really walking the talk of the university.
It ain't Jesuit, baby.
Yeah. And so, you know, you go, any person who's in healing goes into it either because someone healed them or they believe that they want to help people do that. There's usually an altruistic reason why, or they're just fascinated, or they're control freaks that want to control people. Who knows? There's lots of reasons why.
Weirdos out there, I'm sure.
And so, you go into this and you have to do 3,000 hours, and typically you're not paid very well, but you know that. And so the jobs that will take you are community mental health.
Right.
And the turnover rate is incredibly high, which is really fucked up when you think about it, because these are pretty low-income populations who have gone through a lot of trauma. They need consistency.
Yes.
They need structure.
Yeah.
They need to believe that the same person's going to be there.
Right.
And so you go in there thinking, I got this.
Yeah.
And I don't think I ever stayed at any job more than 6 months. I don't think I made it through any of my traineeships more than a year.
Yeah.
Because first of all, the paperwork was exhausting.
Yeah.
It was all pretty archaic.
Right.
It was all Medicare was through fax.
Oh, Jesus.
And every week I had to redo a 6-page report.
Oh my God.
To talk about what treatment I used. And I lied half the time. I would create something that was a document, cut and paste it.
Yeah.
And that's what you're actually told to do to make life easier for yourself.
Because it's not sustainable.
No. And this is, again, at the time you're told CBT, which cognitive behavior therapy, that's the gold standard. DBT, group therapy. These are the gold standards. These are helpful for thinking problems. But when you're dealing with trauma and I don't care what you say, any or stress related issues, it's not a disorder of your thinking. It's in your body.
Right.
I cannot say. And so what they're saying is, well, in 6 weeks, this person, so let me go back. You would be told to put what's called a CPT code, which the DSM, when mental health said, okay, if we're going to get covered, we have to actually become more like the AMA. We actually have to have codes. We have to have, where in medicine, it's ICD codes. I think it was 9 when I was doing it. I don't know if it's 10 or 11, but so you come in, you're talking to me about stress. I'm going to go, okay, she has acute distress disorder. I can use that for 2 weeks to 4 weeks. Then I have to give a diagnosis, which again, I'm not a doctor. I should not legally be giving, so I would call them provisional diagnoses.
Right.
But the DSM, the insurance companies say, well, if you're using CBT, they should get better within 12 weeks.
Who fucking made that rule? Definitely not a clinician.
Well, yes and no.
Oh,
but again, I talked about this in the TikTok post I did. This is brought down from patriarchal, academic, white, supremacist idea. You come to me, I'm the fancy degree.
Right.
I can get you better in 12 weeks.
Oh my God.
Well, here's the problem. What we know now, and I think we've always known this, is it's the relationship that builds.
Right.
And the person I mentioned before in the podcast, she was talking about how placebo actually, what was it? Like the CBT rates, it's like 20%. Placebo's 30%. I'm making up the number.
Yeah.
But just the power of the belief system that I'm coming to therapy, I'm going to get better, that works just as well. So the fact that you would have to kind of come up with, well, okay, what's the diagnosis I can give that's going to, one, buy me as much time as I need. Yeah. But then I'd have to say what interventions I did. What did I do? What did I do? What did I do? Half the time I was just building rapport with people.
Right.
And maybe I might get something and I might hand them a worksheet at the end. Yeah. But then sometimes the claim would get denied. And I, as the healthcare provider, would have to sit there with my client and say, I can't see you anymore because you didn't get covered. Can you pay out of pocket? Here's how much it costs.
Oh my God.
So when, again, private practice, I thought the internship I did, she said, hey, insurance is your bread and butter.
Yeah.
Do insurance. You'll get reimbursed. The rate, I think it was Kaiser at the time, was like $50 an hour reimbursement rate.
Yeah.
Which that does not cover the cost of your rent, your admin, my health insurance, which I don't get.
The average cost of, I've been through a lot of therapy. The most recently, it was $180 for an hour for 50 minutes.
For 50 minutes, I charge $200, and that's standard in California.
Totally.
And so again, you're having to play these different roles, and this is just outpatient therapy.
Right.
Let's not even don't get me started on the amount of times I've worked in inpatient residential settings. And that's where I talked about the utilization review. Sometimes after 3 days of the person getting there, they're just getting settled in. I would have to get on the phone with the insurer and tell them what progress they made. They've been here 3 days.
Yeah.
And this is a 16-year-old who slit their wrist.
They don't even know where the bathroom's located yet.
Molested them.
Oh my God.
Sorry. No, I haven't given them their, subjective units of distress talk yet. I'm just trying to make them feel safe and secure.
Right.
Sorry. So, okay. So, it's very difficult. I don't take insurance.
Yeah.
And what I do is I hold 5 spaces in my practice that you pay me whatever you can. I don't care if it's $1.
Yeah.
And those are filled. And when one person moves out, some person moves in. I've absolutely lowered my costs if someone has a financial hardship. That's great. Because I'm just me. But sometimes I can't. There's been times, education. I know, right? Well, you know what though? It's my dad and my mom. Yeah. Because my father did that. Yeah. My father went out of business because he did that shit. And, and also he refused to get a computer and did everything.
There were other factors. That was other one. Factors, that was one.
But that's how he went into this because he loved medicine. Yeah. And he would always say hospitals were meant to be doctors' workshops. Right. This was a place where you would get to go and do your craft. Yeah. And do it well and learn, and not these, hospital is this and all these for-profit shit. So, it becomes really, actually traumatic as the clinician to do this work and be that intermediary between the patient who you're supposed to be doing one thing. Now I'm talking about money with you. Yeah. So, it's awful. Yeah. It is awful. Stressful. It's fucked up. It doesn't have any relevance to what's happening. And we talked about this in the last episode, social determinants of health. Yes. Do you get sick days off? Do you have access to clean water, food that's affordable and healthy? Do you even have a good relationship with your providers? Yeah. People in rural areas, I can never say that, rural areas of America. Rural. God, talk about Native American reservations. Fucked up, marginalized people you're not fucked up and marginalized if you're a person of color, but it's fucked up. The system if you're marginalized and a person of color. If there's any intersections of mental health disorders, suicidality, substance use disorders, all of which to me are coping mechanisms that you use to deal with all the shit that you're going through. Yeah. They're going to struggle with access, quality, affordability of healthcare. Like I said, the turnover rate in a lot of these community mental health programs, you're getting people every 6 months. Yeah. And you're getting, now again, I always had wonderful, phenomenal supervisors, people who were, and I believe there are really good people out there doing that. Yeah. But most people don't even go because they're afraid of the healthcare costs. Lots of people who are really showing signs of heart attacks, but they're not going to go, or they're going to drive themselves.
That's too frequent a story.
Because they don't want to pay can't afford to pay for the ambulance.
I'm not getting in an ambulance. Yeah, exactly.
Too much money. So again, we made a political decision to have a market-driven healthcare system with a profit motive, and it leaves people out. Yep. The ACA, Medicaid tried to help with this, and many of us are tied to our healthcare through our job. So if you lose your job, you're stuck.
Right. It's all predicated on the capitalist system. Yep. You only have value and are worthy
if you're contributing.
Yes.
And low income individuals and people of color in the United States face higher challenges under the current health system. If you want to talk about that in real time, look at the pandemic. Who got vaccines first? Right. Who didn't? Right. Who was getting care? Who wasn't? Yeah. Look at the disparities and these key factors contributing to this: high cost of burdens, insurance coverage gaps, lower quality employer sponsored plans, health disparities. So in November 2021, American Indian and Alaskan Native, Black and Latino people all suffered from higher rates of hospitalization and death related to COVID-19 compared to Caucasian people. Right. These inequalities result in a large part from the racial and ethnic minority populations, inequitable access to healthcare, and it persists, like you said, because of the structural racism in healthcare policy. I don't want to have that conversation if you're not going to bring that into the table.
Yeah, no, absolutely. And I think that's a whole episode unto itself.
100%. Yes. So, and I think what telehealth did is it made things accessible to people. Yeah. And I do believe that there are certain things that you can do over telehealth. Yeah. can't get a breast exam over telehealth.
There's limitations, right?
There's limitations.
I have a cyst above my butt crack. Now y'all know me real well.
Do you really?
Yeah, it's just like a completely benign
Can I
cyst.
see?
Yeah. But I remember
Really?
being on a video doctor visit and trying to show the doctor my ass crack while she's eating her lunch. God bless her. I fucking love this doctor. She was the best. But I'm like, what? So now I insist. I'm like, I got some weird bumps, whatever. I'm coming in, y'all.
Well,
but it's a cost saving measure.
And this is what's crazy to me, because from a malpractice perspective,
Yes.
what? Yeah. I mean, it's just, but, and, again, we're doing charting. And audits are important. And I get utilization reviews to the point. They want to make sure that people, and there are shitty people out there who are going to say, oh yeah, this person needs 30 more days.
Yeah.
Because let me add the caveat that some of these for 30 days, it was between $30,000 and $50,000 a day.
Oh God.
Which was, I was making 20 an hour.
Oh yeah.
So you tell me where that money was going.
Right. Oh, it's awful. It's also awful. Listen, I was going to tell you some health insurance horror stories to close us out, and I decided I'm going to focus on one from my own family, because you know that my stepdad, approximately 15 years ago, was diagnosed with a brain tumor, glioblastoma, which has a very high mortality rate. Somehow he survived.
15 years.
Yes, 15 years. I say somehow, but really it's my mom.
Yeah. Yeah.
I happened to be at their home during times when she would be on the phone advocating, because the hospital would try not to cover things. And her full-time job was an advocate. And if she weren't there, Carlton would have died within a year.
Oh, well, and let's talk about SNFs, skilled nursing facilities.
Skilled nursing facilities.
And the fucked up shit. I mean, that's just like the same shit you're going to have in a recovery.
Right. She had my mom and stepdad had a ton of bad experiences. But one story in particular that my mom told me when Carlton was initially going through his brain cancer diagnosis and treatment and everything, they showed up at the hospital and the nurses, admins, whatever, were like, you don't have insurance right now. And they're like, what happened? Something happened. He at that point was still being covered by his employer. Something happened. I don't know what exactly happened, but my mom said she overheard the nurses, admins talking, saying, this is the saddest situation. There's a wife and her husband in the waiting room, and he has brain cancer, and their insurance has just been canceled. And my stepdad was very fond of saying, if you're poor in this country, they will just let you die.
In the waiting room.
Yes. And, that brings us to our final thought, because we've said a lot. So, getting sick in America absolutely sucks. And most of us are just one catastrophic illness or injury away, like my mom and stepdad, away from financial ruin. And it did cause financial ruin for them.
Yeah.
In our capitalist system, like we said, our ability to take care of our physical and mental health is inextricably connected to our ability to work, since most of us receive health insurance through our employers. From GoFundMe pages to taking out personal loans to bankruptcy, Americans are trying to manage exorbitant healthcare charges, and we're fucked. Remember the immensely popular show Breaking Bad? Think about it. The basis of that show is uniquely American in a lot of ways. It's not just the meth, but the most American of American shit is the fact that Walter White had to resort to making and selling meth to pay his fucking medical bills. That is some sick shit, pun intended. The way Carolyn and I see it, the only way out of this predicament is to institute a system of Medicare for all, similar to Canada. Yeah, the system isn't perfect, but let me tell you, we ain't never seen a Canadian or any citizen from a country with universal health care go bankrupt due to health care costs, and they never will. So this is our big fuck you to the health insurance industry, as well as our attempt to encourage you all to keep pushing for universal health care.
And get good sleep, and go for walks, and check in on your friends.
Take care of yourself so you don't become immersed in the system.
Those things are free.
Yes, they are free. And check out the movie, what is it, the Blue Zones documentary, or How to Live to 100. The key to longevity and health is walking.
Yes.
Keep walking. Eat a Mediterranean diet. Keep your asses healthy.
Yay.
Come on. Step away from your computers. It's important, y'all. All right, everybody. We hope you enjoyed this episode. You can find us on TikTok at twat. JC, TWAT, JC, emphasis on the twat. You can listen to us on Apple and Spotify, which I'm sure you're doing, and we appreciate it. Have a great night.
Much.
We'll see you hopefully within the next week, 2 weeks, with our episode on boycotts.
Yes.
Yeah. All right, everybody. Good night.
Bye.